Hi, everyone, and welcome to GLF Live, a series from Landscape News and the Global Landscapes Forum of live interviews with experts on COVID-19. I'm Gabrielle Lipton, the editor of Landscape News, and today we'll be hearing from Dr. Aaron Bernstein. Dr. Bernstein comes to us from Boston, where he's at Harvard University, currently serving as the interim director of Harvard Sea Change, which is Harvard's Center for Climate, Health, and the Global Environment. And within Sea Change, he co-leads a program called Climate MD, which works to educate medical practitioners about how climate change affects their work, from its effects on diseases to the risks it poses for things like the availability of medical supplies. And he has a number of other roles, including assistant professor of pediatrics at Harvard Medical School, and he serves as a pediatrician at Boston Children's Hospital. So thank you so much for taking the time to join us, Dr. Bernstein. We're very excited to hear from you.
Nice to be with you, Gabrielle.
So given your specialty in pediatrics, how is this epidemic specifically affecting and going to affect children?
Well, the good news in that regard is that the virus seems to be much less severe in children. So while children can get sick, and particularly children who have chronic medical problems can get really sick, the virus seems to be much more gentle than in adults and older people. But there are real consequences for children that range from disruptions to learning and how that can affect, anyone in grammar school through high school in the US and, the equivalents around the world, to cohort effects that we often see with pandemics. So if you look at children who lived through the polio era, or for that matter, other pandemics, these diseases can shape people's worldviews in profound ways and change their understanding of risk about infections and other things. I think there's also a really important part about what this means for children when it comes to equity. So we know from past infectious disease outbreaks, and we already have evidence here, that families that are already not well off are more subject for the parents to potentially be sick. They're more likely for those parents to have long-term economic harm, and that, of course, is a major risk to the health of children, regardless of where they live. So while children may not be in immediate crosshairs from this infection, there are real consequences both in the near term and down the road that we need to be mindful of.
Mm-hmm. There are many elements of the causal relationship between the changes humans have made to the planet and the spread of COVID-19. Given your work about the intersection of health and climate change, which of these causal relationships do you hold to be the most important?
Well, particularly for this audience, there's clarity about the role of land use change and how we frankly do business with the biosphere. That speaks to how important the emergence of these diseases from wildlife in particular is. And that means that we can do more to prevent spillover. We can do more to, understand where pathogens may be living in wildlife and take actions that prevent the spread of those pathogens in the people. And of course, we can also do more to improve surveillance so that when there are outbreaks, and there always will be outbreaks, that we detect them earlier and can prevent epidemics as we're seeing today. So I think there are many measures that relate to human interface with nature and how, given the scope of humanity on the planet and the demands we place upon everything from forests to wildlife, there's a lot that can be done to reduce the risk of these things happening in the first place.
Mm-hmm. Absolutely. What has surprised you about how COVID-19 functions and how it has spread, and what has it taught you about infectious diseases? What have you learned from this?
Yeah, my honest answer to that is I honestly can't think of anything that has surprised me about this.
Mm.
We know that emerging infectious diseases overwhelmingly come into humans from wildlife, so that's true with this. We know that our health systems are really not investing in early detection and prevention. So the fact that this was not picked up early and contained effectively anywhere, with the possible exception of South Korea, uh, is not terribly surprising. The reality that this infection has a disparate impact on adults versus children is not surprising. We see that all the time with viruses. And perhaps most importantly, its enormously powerful effects on amplifying inequality are not surprising. That's what we see with these things. So this virus emergence was entirely foreseeable. Its effects were foreseeable. And what we need to do to prevent them is also pretty well understood. And so I suppose in some ways, the only good news in all of that is that I think we're doing better as a world community today than we have necessarily in the past, even though we obviously have lots of room for improvement. And my hope is that since we don't have a lot of surprises here, that we'll do more to use the knowledge we have to prevent these problems, infectious disease emergence, and its upstream causes, which include, as I mentioned, how we're doing business with the biosphere, so that we don't have to go through this again anytime soon.
Absolutely. Following up on that, how do you hope to see this be used to reshape health systems for the better?
That's a great question. We have, on balance in the world right now, health systems that are generally equipped to deal with people after they get sick. And we need that. People are, our health is not perfect. And even if we do everything we can to keep ourselves healthy, our health may fail us. But on balance, the investments are just wildly disproportionate. So the amounts that we're spending to keep people healthy in the world are fractions of the amounts that we spend after the fact. In the US, we spend several $1 trillion after the fact. And we spend maybe 1/100th to 1,000th of that to keep people healthy. So it turns out that COVID aside, if you don't prevent disease, you're never going to be able to pay for it after the fact. And for that matter, in some cases, as with COVID, we can't really even treat it effectively. I mean, we do what we can, but there's no real treatment for it. So I think when it comes to healthcare investments, this is one example, although we didn't really need it, to really underscore that prevention is enormously cost effective. And frankly, and COVID is a good example of this, the only path to preventing huge amounts of both economic and human harm, because there will always be the risk of disease emergence from wildlife into people, and our healthcare systems are never going to be able to sustain the infrastructure needed to deal with pandemics on an economic basis. We're not going to be able to have all the ventilators and all the ICU beds and all the medications that might be needed for any potential epidemic that could emerge from wildlife. That's not going to be economically viable. And so really you have to spend money to prevent these things from happening.
Mm-hmm. Do you have any examples of how that specific target areas where that money can be put?
Yeah, I mean, there have been many great examples already. In Bangladesh, for instance, which has been subject to Nipah virus epidemics, it was recognized that bats were transmitting the disease to people through palm date sap. And so the spillover was truncated, that there was investments made. Bangladesh is one of the first nations in the world to have a One Health ministry that integrates animal and human health. And they were able to mobilize to take actions to prevent that. There have been rabies initiatives that have both done surveillance and vaccination in targeted ways to prevent rabies from spreading from animals to people in the United States. And so there are many examples of how this has been done successfully. I think they are just radically, extremely underfunded, and in the context of the cost benefit here about what needs to be done.
Mm-hmm. In an interview on the 20th of March, you said that the actions we need to combat climate change are the same actions we need to make people healthier right now. Can you give some examples of these actions?
Yeah, and that includes for COVID, an immediately clear example of that is air pollution, particulate matter air pollution. That kills millions of people, maybe 4, maybe 6 million people, overwhelmingly in Asia each year. The pollution in many places comes either from burning fossil fuels, burning forests, or burning agricultural waste, all of which are major sources of carbon pollution. And air pollution in the instance of COVID has been shown to increase people's risk of dying, so that people breathing dirtier air are more likely to die from the disease. And that's accounting for their pre-existing health, their access to health care, and a variety of other factors that would determine whether someone might get sicker or not with the disease. So, if you don't deforest and you don't burn fossil fuels and you don't do slash and burn agriculture, you prevent carbon emissions, you save lives, and you decrease risks from diseases like COVID. And again, it's not just COVID, it's really any respiratory infection. I might also add that there's a lot of harms from air pollution short of death. So we know that those same air pollutants that are causing premature death also cause asthma in children. They cause bad birth outcomes for women who are pregnant. They can damage brains. They can cause heart attacks and strokes, and they can cause lung cancer, among other problems. And so the benefits are enormous when we find ways to prevent air pollution. And there are other ways in which climate actions are health gains that are really critical to health problems that are enormous in the global scope of things. For instance, obesity. Obesity is happening around the world. It is going to contribute to healthcare bills in pretty much every country you can look at. And obesity is caused by changes in diets and lack of exercise. When I started as a clinician in the United States, obesity was essentially a rare disease. And now we're looking at maybe a third of adults in the United States being obese over the span of a few decades. And that's pretty much because we've moved to enormously unhealthy diets. And those diets are cheap. And when you start looking into why those diets are cheap, it's in large part because we've not fairly valued the cost of fossil fuels that are producing the fertilizer, doing the processing that makes them have long shelf lives. And so we have a real conundrum on our hands now because we have underpriced food in world markets, particularly processed foods, for so long that paying the true cost of those foods would mean an enormous increase in food prices. So I think we now have to sort out how to put the fair price of food in play in an incremental way that will hopefully help shift diets to keep people healthier without, in fact, increasing food insecurity, which is not an outcome anyone wants either.
Mm-hmm. Some major issues. You mentioned before putting more funding toward the spread of zoonotic diseases. What other advice would you give to leaders to better combat the spread of future epidemics?
Well, I think you focus on both sides of the spillover fence line. So you focus on looking for pathogens in wildlife and domestic animals. And then you look in human populations that might be the ones most at risk for spillover to happen into. Those might be people who traditionally consume bushmeat. It might be people working in large livestock operations. And you have to do surveillance for the appearance of these diseases. I think there are more systemic issues. at a root cause analysis of these problems, investments have to be made, frankly, in the conservation of biological diversity and in the prevention of climate change. The reason for conservation is that as nature gets dismantled, the risks of human-animal interface go up in most cases. And when it comes to climate change, we're shifting risks of where infectious diseases may emerge, and that makes it hard to prepare effectively. So, if you're used to having something appear, a disease appear in a certain part of the world, and you might be able to spend money to prevent it in that area, but climate change is pushing to somewhere where there's no surveillance, that isn't helpful. So I think there's, one of the lessons from COVID is, again, that after the fact actions are, what we do and probably what we have done best. And in this world where we've got, a lot of people and a lot of interconnectedness and increasing urban density, we have to be smart at that. And so my hope is that we can leverage the pain that we're all going through right now to make investments that will provide for a healthier human population.
Mm-hmm. Thank you. So we have about 5 minutes left. So I'm going to look to the audience questions. We have one from Gregory McGann, and he's asking, should health officials be talking about climate change now, even though there is a global health pandemic ongoing?
Yeah, it's a good question. So I wouldn't necessarily say that everyone should be talking about this, but I can tell you that I want to talk about it as someone who's a provider, is taking care of people who may have this disease, and someone who spent a lot of time working on climate change. The first time I recognized the need to talk about this was being with a family where we were concerned that the child had COVID. And that was because I recognized that we can wash our hands all day and socially distance all day, and we're still going to have this kind of problem. And so on the one hand, as I mentioned, climate change and air pollution have the same cause in large part, which is fossil fuels. So if you stop burning fossil fuels, we stop making air pollution, which makes this disease worse, as well as lots of other infectious diseases. And we also know that climate change, as I mentioned, is driving disease emergence potentially. And so, you don't want this to happen again. As I said, you're never going to make the ventilators and the ICU beds. I mean, we can't even get enough hand sanitizer. So you really do need to invest in these upstream causes, because even if you have the money, you can't necessarily have the supply chains or the materials available to deal with it.
Mm-hmm. Right. The next question comes from Xenia Maria, and she is asking about more or less the size of the areas of natural habitats that we need to focus on in order to minimize the risks of pandemics. Should we be looking mainly at untouched ecosystems, or should we also be looking at urban ecosystems, or things like secondary forests, things that have already been touched a bit? What should we mainly be focusing on?
That's a great question. So the conservation community would say we're looking for 50% of habitats, protected on the earth, and we're not going to get there tomorrow. And so the first, how do you prioritize? And in the context of infectious disease emergence, you can start to make educated guesses about the places in which, it's the human-animal interface, right? So where there's a greater diversity of animals, particularly animals that are potentially more likely to be reservoirs, those are places where you want to make sure habitat is protected. A good example might be West Africa, where we know that deforestation has contributed to the spread of Ebola, because the bats have been forced to move because there's no forest for them to live in. There's that guidepost. But the reality is that depending upon where in the world we're talking about, and the governance structures that are in place and the incentives and financing that's available, you can have all the ideals you want, and you're going to have to start marrying them to the realities of what's driving human engagement with nature. And so I think part of what's happening with COVID is that everybody recognizes now that we can do everything we want as individuals to keep ourselves healthy, but our health is really only as good as the most vulnerable people in our societies and frankly around the world. And that just speaks to how important it is for international cooperation around conservation, as one example, which we've seen historically, but I hope will grow.
Absolutely. Well, Dr. Bernstein, I know that's all the time we have with you today. Are there any other messages you would like to share with the audience before you go?
No, I'm delighted to have the chance to be with you all this morning. Please feel free to email me. My email is public. It's on the website, our center's website that you have. And thank you for all you're doing amid this pandemic. It turns out we in fact are all in this together, whether we see it directly or not. But the fact that I'm taking care of people in Boston who have a virus that likely emerged somewhere in China, on its face makes it pretty clear that what happens around the world matters to me right here.
Absolutely. Well, thank you so much, and thank you for making yourself available to our audience. That's really wonderful. And to everyone who joined us, thank you for your time. And next week, we're going to be having another GLF Live looking at how COVID-19 is affecting food systems and global food supply. So please join us for that as well, and we will look forward to that. Thank you, everyone, and have a great rest of your day.